Hello, today I'm going to talk about Chalazion. A Chalazion is a red bump on eyelid. Sometimes it is called eyelid cyst or a meibomian cyst. It slowly forms when an oil gland becomes blocked. At first, Chalazion may be painful, but after a little time, it usually does not hurt. A Chalazion typically forms on the underside of your upper eyelid, but may occasionally form on your lower eyelid. Ordinarily, chalazion develop in adults between the age of 30 to 50 years. Some of the symptoms that someone would notice when they have chalazion is things like they'll notice a bump on their eyelid and a painful, but pain will quickly go away. As the chalazion grows, it may become red, swollen, and tender. There will also be mild irritation causing the eye to water. Blurred vision from a larger chalazion that is pushing on the eyeball. So those are the signs that you'd notice when you're examining someone who has a chalazion. So like the picture to my left is a painless roundish film lesion within the tarsal plate. So this chalazion may also rupture through conjunctiva and cause a granuloma, as it's being indicated in the picture that is to my right. A chalazion develops when something blocks a small oily gland in your eyelid, and this gland helps to keep your eye moist. A blocked gland begins retaining oil and swells. Eventually, the fluid will drain, causing irritation to your surrounding eyelid skin. This irritation can lead to a hard lump filled with the oil and fluid on your eyelid. So larger chalazion can press on the surface of your eye, that is a cornea, which can lead to blurred and decreased vision. So management of chalazion most of the time is within a month it can go on its own, but first never push on a chalazion or try to pop it out, because this can cause inflammation and infection. But what you need to do is, if there is a chalazion, you do warm compresses. So you do warm compresses, let's say 3 times a day. You practice good read hygiene. So this includes when you are waking up in the morning, you wash your face, avoid touching your eyes with dirty hands. Those are some of the good read hygiene that you need to do. The other thing is incision, and the other treatment or management is injection of steroids. So like in the picture we are seeing to my far left, that's injection of local anesthesia when they want to do an incision of a chalazion. So that's how it is performed. Prevention: we can prevent a chalazion by washing our hands. Contact lens care, let's take proper care when using contact lens. Face washing and makeup hygiene. So chalazion, if proper management has been given in time, it can go away within a week. If left untreated, it can take 4 to 6 weeks, but sometimes can persist for many months.